For those who come in and out of Nairobi, they could possibly get the COVID-19 and not show the signs and symptoms, yet transmit wherever else they're going to visit. This is not the first outbreak of a disease. You remember that some few years ago we used to have the cholera, and we did a lot of public literacy, a lot of public education on health matters, on cholera. COVID-19, unlike for other illnesses, you could still be infected without showing the signs. So most of the people think they've not gotten COVID because they've not seen themselves having any signs and symptoms. When we talk to people, they still tell you, I've not seen a neighbor who has had COVID, I've not seen a family friend or a family member or a neighbor who has COVID and has gone to hospital. So the issue, the greatest issue is those who go to hospital are those who have developed the severe disease or complications. So out of that number, we also have a major group that has COVID-19 but is asymptomatic. You remember in 2020 we were doing the mass testings, and this was very evident. You could test someone, tell them they've gotten a positive result, and they refute that result. They say that maybe you've mistaken the result for somebody else. I'd like to say that some of the public transports are very careful. It depends on circle, it depends on the route. But as much as we want to blame the public transport, what is our role as the citizens? Do we have to be coerced to overload in a matatu? Is it the matatu crew who is supposed to tell you to put on their mask? It is we ourselves to take this responsibility upon ourselves. If you're going to board a matatu, make sure you observe the protocols of social distancing, and also make sure that you have your mask throughout the transit. Ensure that you also sanitize your hands or you wash your hands before you board the matatu or as you get off. If you know the pain, like you're saying you've had two bouts of COVID-19. If you know the pain of having the disease, it's not equivalent to masking, social distancing, and also doing your hand hygiene. Once you weigh your risk perception and see what are the issues that can make you infected with COVID. If it is clubbing, you say, I will not club. If it is gathering, I shall not gather. If it is about putting on my mask, I will put it on. And put it on constantly. Not at times I have it, at times I do not.
Lilian, that's fair.
Even if you have the COVID, you'll say you will not know where you got it from. But you can't tell me you are relenting to put on your mask. You only put on you've seen the policeman. Or you're putting it on because you're fearing your boss.
Yeah.
He'll ask you. Then it means you don't know why you're putting it on in the first place. And it's about us as Kenyans to uphold directions that we have been given. Let's take an example in school. I know as we went through school, our parents and our teachers and maybe our older brothers and sisters were telling us, you need to read extra, you need to work hard extra. You don't only get good grades by being in class and listening to the teacher. You need to sit down by yourself and read. Where you do not know, you ask. The same with COVID. You just need to be persistent.
You know, while I understand what you're saying, it's personal responsibility, that's where it starts. It also is not realistic. At least it's utopia that would work. This isn't utopia. In reality is, unlike what the president once said, security starts with you. No. If everyone was responsible on their own, that ideally would work. But that's why we have laws in place. That's why we have policemen walking around, so that not everyone can feel the right to take what doesn't belong to them. Now, when you come out and say, like the president did, you saw the backlash when he said, sasa security inaanza na wewe, ama wanaiba, mnataka nifanye nini? That is lack of responsibility. As a person on the ground, as someone who is working towards ensuring this country and this county do not suffer from the ill effects of this COVID situation any longer, what are you doing? How are you sensitizing people to the new variants, for example?
In the government, we always say that we don't know why people think the government are the officers and the leaders in the government. Those people are put there because of citizenry responsibility, because there's someone who needs to give directives, there's someone who needs to give leadership, there's someone who needs to make the structure work, and that is why the officers are there. And the biggest stakeholder of any government is the community. So in anything that we do, we should know that the community should take responsibility. Once they've taken responsibility, then they can take charge the government and ask them, we've done this much, what else are you able to do and why are you not doing it right? But every time pointing the fingers to the government will not help. For example, in Nairobi, we walk into the working places or the closed institutions. We've walked into schools. We are going to the communities doing what is called community engagement. And by saying community engagement, I'm not saying that we call for barazas or meetings. What we normally do, if it is in a marketplace and we want to tell people about the risk, we are going to go into that market with a public address system and address people as they continue with whatever they are doing. If it is in the schools, we've been there, we look at whether there is adequate hand washing facilities, whether the students or the pupils understand why they should put on their masks. Even observe, by just observing what people are doing, you can find a gap or assess and find there is a need, and we are able to come in, and if it is a gap, we are able to tell them what to do. If it's a need, we can also do multi-sectoral collaboration with the people who need to assist. For example, we've gone to some schools, they have the hand washing facilities, they do not have the water. So we are able to talk to the Nairobi Water Company to see whether they can avail water. And if the school doesn't have piped water, we've been able to liaise with NMS to give water by the water boozers. We also knew that in 2020 people were saying that hand hygiene cannot be maintained because in the informal there wasn't sufficient water. We have seen very many, more than 30 boreholes being placed in the informal settlements. So there's also citizenry responsibility, being the first, like you just said. And if at any time you will get COVID and you feel the pain of breathing, then you'll understand why we are saying that everybody should just put on their mask. At times we get people telling us that once they put on their mask, they are not able to breathe. But if it is only if you do not know how to put on the mask properly. Even the mask,
some masks are not
it
good.
has
Some masks
a
are not
technique.
dope.
It has every mask has a technique of putting on. So if you do not put it on properly, then you'll have a problem.